Welcome to Love Bites. Love Bites. Love Bites. Love Bites.
In terms of, women's bodies, like before, if they're looking to get pregnant, and like during and after, of course, there's like a ton of hormonal changes, right?
Mhm.
So, what are your like 3 biggest tips for women that want to like go through that process?
That's a really big that's a big process, right? We're talking
Yeah.
about years of your life. So the first tip is to recognize that anytime we have pressure, if we're talking about trying to get pregnant, this is something that never gets talked about. And that is the pressure to have sex makes you not want to have sex. A lot of people, when the sexpectation is there, you're like, no, that's a turnoff. I'm not into it. And so a lot of couples will find that like they're supposed to time sex and they're supposed to like you have to time it. There's timing to that. But that kind of calendar, that kind of pressure, that can make it really hard to get in the mood. And so acknowledging that, having that conversation with your partner, trying new things, like that's a good time to be like, you know what? Like if you don't have kids already, like book a hotel room, maybe try role playing, get some lingerie, like do some things that are going to maybe take you a little bit out of your comfort zone because it's going to spice things up and make it more interesting so that you're not so focused on like the goal is that we're supposed to mechanically just have a baby. So that's a really big issue that people run into, but like everybody's talking about how to try to conceive and they're like fertile cervical mucus and look at this and look at that, but like nobody's talking about like, but you got to want to have sex in order to get pregnant. So during pregnancy, that is a time where your libido may go down. It may skyrocket. A lot of women, not a lot of people talk about it, but they talk about it behind closed doors. Their libido skyrockets. You have tons of hormones. You also have tons of blood flow down to your clitoris, your labia, your vagina. You'll self-lubricate a lot easier just by way of how much blood flow is there. And sex is good for you. So unless you have a medical condition where your provider's like, you can't have, any kind of penetration, even then you can still usually have oral sex, or you can use a toy to stimulate the clitoris or manually stimulate the clitoris. So there's still things that you can do. I think a lot of women get shocked by how their libido is up, and that sex is actually great. So orgasms help with toning the pelvic floor. It also helps you get present in that area. Like there's all these like, meditation and mindfulness gurus. And I'm like, y'all just like work towards orgasms because I'm telling you that is the like most solid act of mindfulness right there. And it's fun.
I would agree.
And the dopamine reward is very good. It's like, do that again. So
yeah,
sex in pregnancy can be great. Also keeping up the circulation in the pelvic floor, all of that can be fantastic. And it's a good time to start experimenting with new positions. So, a couple, sometimes they just have their go-to position. As your belly gets bigger, as your hips expand, as your butt gets creative, you've got to change positions. And that is the time that I joke about in the book of like put like for anyone like put those like cute little pillows that you have on your bed to use. Like if you're one of those pillow people, get those pillows to use. Otherwise, get some pillows. Putting a pillow under your hips like anytime is a great way to expose your clitoris, to position yourself for vaginal penetration in a way that can be a lot more pleasurable. And as you go through pregnancy, you may find that like you need to do a sideline position and get pillows like between your legs. It's so interesting to me how many times patients are like, do you mean sex positions I experienced in pregnancy that I'm like, this is where it's at that they wouldn't have done anyway. So give yourself permission to try things out. Because sometimes we see in the movies and stuff where it's like, oh, we can't have sex anymore because like she's too heavy or this is like, that's all BS.
I believe so.
Yeah. And
I'm so excited. I can't wait to have pregnant sex in the future. Very excited. So my Love Bites fam, I'll be back to report on my pregnant sex situation.
Yeah, I do have to say that like my husband, I'm gonna just like share a little bit of TMI, but I think he'd be okay with this one.
Love it.
So in my last pregnancy, he was like, I can't keep having sex every day. Like, why are you? He's like, and multiple times a day you're coming to me. And I'm like, I don't know. But
Oh,
my
I
body
love
is
it.
like, you need sex. But yeah, he was just like, like, just turn to the vibrator and give me like a moment, like here.
Yeah.
So
Yeah.
it is really a common time to see that like libido is up. And because you have all these aches and pains and even headaches sometimes in pregnancy, sometimes, that's like the go-to of like, oh, not tonight, honey, because I have a headache. It actually could relieve a headache. It also can help with aches and pains because of those endorphins that get released. And as it's releasing endorphins and oxytocin, that's blocking cortisol, which for the long term of your baby's health, like for their lifetime, having those lower cortisol levels is going to benefit them. It's going to make them more resilient in their lifetime to stress. So you're also taking care of baby by taking care of yourself.
Yes. We're aiming for happy babies.
Yes, absolutely.
Postpartum, let's talk about that because that is an issue where millions and millions of people experience.
Yes. So postpartum is a common time to have pain with sex, but you should never accept that as normal. Okay. So this is something where doctors will often say, you just had a baby. It's normal that you have pain. No, it is not. It is common that you have pain, but you need to figure out why you have pain because something else could be going on. And often doctors are like, just use lube. Okay, sometimes that's where it's at. And especially postpartum, your estrogen is going to be down. So it's a drier time. But I want to encourage everyone in the book, in the chapter of sex of all kinds, I actually jump into like, if we're going to talk about vaginal sex, we're going to start with pain with sex because 1 in 3 women experience this and it's not normal and it is very much ignored. And so if you are postpartum, and you're finding it's not pleasurable, it's just painful, meet with a pelvic floor physical therapist, meet with somebody who specializes in rehabbing that area postpartum, because not only can it make it so you have better sex, but you also will be less inclined to pee yourself. And who doesn't love that?
Love that. My last question is a question I get a lot from my followers is how are hormones connected to low sexual desire?
Now, the number one everyone jumps to is testosterone, because yes, it's absolutely associated with sexual desire. However, it's not always a testosterone issue for people. So it's important to keep in mind that testosterone is important as I talk about all this, and it could be a testosterone problem, especially we see if you're on hormonal birth control or if you're postmenopausal, testosterone can definitely be an issue. But what often gets forgotten is cortisol and what's going on with your stress. And that is an area I feel like it's just like, it's not sexy. Like we just want to give testosterone and then we'll be like, it'll be sexy time.
Yeah.
And we don't want to talk about the fact that like, you have to deal with your stress. Like your body doesn't understand. Is your boss yelling at you or is a tiger yelling at you? One will definitely kill you. The other will not, but your body doesn't know the difference. And so if you keep finding yourself repeatedly in that fight or flight mode, you're finding that you're stressed a lot, you're not getting good sleep, your blood sugar is imbalanced because you're, just pounding coffee all day and not eating in a way that really supports your metabolism, that can negatively impact your sexual desire because when your partner or the sexy signals in your environment come in, your brain can't hear that. There's too much static and too much noise. And it's almost like, the sex signal is trying to yell over it and your brain's like too loud, too much, not here for it, need to survive. And so looking at how you can reduce your stress levels and how you can support your body to know that it's safe will open up the nervous system so that when sex is presented in the way that you like it, whatever way that is, your brain can receive the signal and then tell the rest of the body, hey, we're going to stop everything and we're going to get down now.
Thanks for listening. This was Love Bites. Love Bites by Dr. Tara. Follow Dr. Tara on social media at lovebites.co. Have an orgasmic day.